Good morning or good afternoon, depending on whatever time you are listening to this. This is a recording of the annual Bloodborne and Airborne and exposure control in service that you are required to have annually for our agency. So if you did not attend this in service during case conference in the month of January, then watching this recording will serve as your sign in or your completion of this in service. So we're just going to jump right to it. Okay, so the first thing I want to touch on with you guys is first of all our policies and procedures. Now, I am going to attach all of these handouts as an attachment with this file that you can download and see, but this is a 15-page policy and procedure, so we're not going to go through every piece of it and read it bit by bit, but I do need you to look at it once this is done and read through it and make sure that you understand your responsibilities in regards to what you should be doing to prevent exposure and the transmission of dangerous bloodborne or airborne pathogens to yourself and patients. So, a couple of things that I do want to talk about specifically from the policy is our agency does have a plan regarding how to control exposure to certain pathogens for you. It is looked at annually and updated annually. I will tell you that not much changes from year to year, but we do look at it and we do look to make sure that we're encompassing all positions here to make sure that everyone is safe. It does classify what employees are the most at risk for exposure. Obviously, the positions that perform things like blood tests by finger stick, venipuncture, any IV procedure, dressing changes of wounds that are draining, removal of fecal impactions, emptying or changing of any drainage device as far as urinary drainage, JP drains, wound dressings that have drainage on them, and collection devices. And then, of course, giving a bath to a patient where there could be excretions on their skin or draining from wounds or incontinence issues. And so, all of those things, with the exception of one, obviously fall under the nursing umbrella. So, of course, our registered nurses and our LVNs are the most likely to be exposed. So, a lot of the stuff that we're going to talk about today does focus on them. But however, home health aides, you guys are obviously at a risk as well, along with our therapy. Dressings can come off, people can have incontinence issues. There's always a potential for a splash or an exposure. So I need everybody to make sure and pay attention and that they're being safe. So obviously, we're going to classify our nurses as probably our top position that would be exposed, then home health aides, and then physical occupational speech therapist and medical social workers probably there at the end because they have the least amount of contact. Um, so that is what jobs are most likely to be exposed. Let's talk about some methods of implementation for the exposure control plan. Obviously, all positions, all employees are supposed to be abiding by and operating under standard precautions. And so our agency has provided you with the tools for that. We provide you with gloves. We provide you with PPE if needed. And we also give you guys hand sanitizer. So all those things are provided to you at no cost to you. So you need to make sure that you are utilizing those as far as protecting yourself as well as protecting our patients. There are sometimes that we do need to use certain precautions based on certain indications that the patients have. So sometimes patients that have things like staph or C. diff, those are going to be using special transmission-based precautions. So in addition to standard precautions, you would also want to use either contact droplet or airborne, implementing for those patients with suspected or documented infection or colonization with highly transmissible or epidemiological, so it's hard to say, important pathogens for which additional precautions are needed to prevent transmissions, of course, in accordance with the CDC guideline. So contact precautions will be implemented along with standard precautions for known or suspected infections or evidences of syndromes that present an increased risk for contact transmission. So gowns and gloves are to be donned prior to any contact with the patient or client's skin or surfaces, equipment or articles within close proximity to the patient or client. Staff will use any disposable equipment whenever possible. Any non disposable equipment should be left in the patient or client's home until the patient or client is discharged if possible. So, if you have somebody who is at risk or have somebody who has a documented diagnosis of MRSA, we want to make sure that we're providing them with their own blood pressure cuff or using their blood pressure cuff. We have disposable stethoscopes and thermometers, so we just want to make sure that the patients that we have documented high risk infections that we want to make sure that we are utilizing those appropriate contact precautions. We're not taking things in and out of their home that could put you or other patients at risk. Contact precautions are indicated for patients or clients infected or colonized with multi-drug resistant organisms, or where the presence of excessive wound drainage, fecal incontinence, or other discharges from the body suggests an increased potential for extensive environmental contamination and risk of transmission. So droplet precautions are to be implemented with standard precautions to prevent transmission of pathogens that are spread through respiratory droplets generated by patients who are coughing, sneezing, or talking. So if you have somebody who has that risk, you're going to want to make sure and you yourself wear a mask for close contact with any infectious patient. The mask is put on upon room entry. Patients on droplet precautions who must be transported outside of the room should be asked to wear a mask if tolerated and follow respiratory hygiene or cough etiquette. So, which of course would be to cover their mouth, to cough into a tissue, or to cough into their sleeve. Infectious agents for which droplet precautions are to be indicated include, but are not limited to, pertussis. The flu is the main one, the adenovirus, rhinovirus, and group A streptococcus. So the big one there that we're going to see the most of is the flu. So if you're going into a home where you know that we have the flu, we're going to need to be using droplet precautions. And keep in mind, nurses, anytime we have somebody on special precautions, we need an order for that. So make sure that we're putting those in our plans of care, writing verbal orders if it's after the fact, and we have to have an order. Airborne precautions prevent the transmission of infectious agents that remain infectious over long distances when suspended in the air, such as, but are not limited to, rubeola, which is the measles, varicella, which is the chickenpox, tuberculosis, and disseminated herpes zoster. So, those are pretty rare. If we have some of those, you're going to make sure and bring that to the attention of me or Cherie. Non-immune healthcare workers should not care for these patients with vaccine-preventable airborne diseases. So if you have not been vaccinated against the measles, chickenpox, and smallpox, or if you have a documented that you are not, if you haven't had an antibody documentation, you shouldn't care for those patients. I'm not immune to the chickenpox, and I have never had I had a titer drawn, and I have no antibodies or immunity, and I've never had the vaccine, so I should not care for a patient who has the chickenpox. Healthcare personnel that are caring for patients or clients who are on airborne precautions should wear a mask or a respirator. Healthcare workers will wear a fit-tested N95 respirator when entering a room with a patient who has infectious pulmonary or laryngeal tuberculosis, or whenever infectious tuberculosis skin lesions are present and the procedure would aerosolize visible organisms. So we don't have any TB patients, but we would certainly have to have you fit tested over at the hospital if we had some, or if we have a patient who has smallpox. Transmission-based precautions remain in effect for limited periods of time while there's the risk of transmission of the infectious agent persist or for the duration of the illness. Okay, so some work practice controls that you guys should practice in order to decrease our risk of exposure or transmission. There should be no eating, drinking, smoking, applying cosmetics or lip balm, and or handling contact lenses in prohibited work areas where there is a reasonable likelihood of occupational exposure, such as where lab specimens are collected. So hopefully you guys aren't eating and drinking and putting on makeup in the patient's homes around those things, because those could increase your risk of exposure. Any surface which has come into contact with blood or other potentially infectious body fluids must be wiped down with a bleach solution, diluted at a 1 to 10 ratio with water, or a commercially prepared disinfectant solution. So all of our sprays and wipes are okay to use on those to wipe those things down. So we're talking about things like nurse glucometers, especially the PT and IR machines. I mean, we know blood is going directly in and around those things, so those should always be cleaned every time when they're exposed or whenever you use them. All sharps will be left uncapped and disposed of immediately into a properly labeled container. If a needle must be recapped for safety, the one-handed scoop method is to be utilized. You should never use two hands to recap a needle. Ladies, how many times have you run your mascara wand down your hand? Very easy to do when recapping a needle. You should always lay the cap down and scoop it up with the needle just using one hand. All nurses are to take biohazard sharps containers into the home for disposal of needles used on venipunctures or when other infrequent procedures are performed. So we issue you guys a sharps container. I'm expecting you to use them. All containers used for collection of sharps must be puncture resistant, closable, opaque, non-breakable, and leak proof. A sharps container will be left in the patient or client's home when venipuncture or other frequent procedures are performed on a continual basis. These containers are to be handled and stored in the home in a safe manner away from children and pets. When the containers are approximately two-thirds full, the nurses to transport the container to the office to be disposed of in an approved manner. So we need to make sure all our patients have sharps containers. It's especially important that they follow the rules. A lot of patients want to use, say, like a milk jug or a Coke bottle. Those things are not okay. The reason the milk jug is not okay is because it's not hard. It's collapsible plastic. The Coke bottle is clear. It has to be opaque. So things that work great for these are going to be like detergent bottles. Those are the main ones we use. We have people have brought those up here to donate. We have a box of them in the back. So I would suggest keeping some in your car to use whenever you have patients. You want to make sure and label them two-thirds full and understand they have to keep the lid, and then we can bring those back here for transmission. It's always a good practice for patients to keep their sharps even after discharge in that same type of container. When it's two-thirds full, it's considered full, so they need to put the lid on it, put it inside like a Walmart sack, and then it can just go in their regular trash. Whenever you're transporting filled containers back to the office, make sure the lid is closed, stored upright to prevent spills, and transported in such a manner as not to come into contact with children or others during the transport. The patient or family shall be taught the correct procedure for storage and use of sharps container in the home. So your patients that are checking blood sugars, giving themselves injections with Lovenox or B12, you need to make sure they understand how to safely dispose of their sharps. This is always something the surveyor is going to look at. So you need to make sure that you are doing those things, not just for survey purposes, but also for purposes of safety for the client. We want to always be safe and, not put pets and children and other family members at risk of exposure. All contaminated materials are to be placed in a closable receptacle and labeled as biohazardous before suitable disposal. We do have biohazard stickers here, and so anytime you're taking somebody a detergent bottle, you can put a sticker on it. We do have needleless systems here as far as engineering controls. So as far as things that need warning labels, all regulated waste containers have to have a biohazard label on them. If we're storing blood or body fluids in a refrigerator, that should have a biohazard symbol affixed at the door. The biohazard label shall be affixed to all containers used for transport of blood or body fluids. So lab bags that you're transporting lab supplies in should have a non-collapsible plastic container with a sticker on it. If you're taking things in red bags, those should also be labeled, and they are. Red bag is a biohazard bag. I'm not going to go over that sharp section with you. I want to draw your attention to item 2, line 5. We do have a sharps injury log that we have to keep. We haven't had a sharps injury in quite some time here. So if for some reason you do have a needle stick or a sharps injury, we're going to go over the procedure for reporting that here in just a minute. But just understand that we do keep a log. So if you ever want to look at it or see it, it's kept in my office. You can see that in the incident reporting file. Okay, let's go over some staff responsibilities. We're on the very last bullet of this slide here. I know y'all thought we would never get off of it, but we are getting down to the very last line. So your staff responsibilities as far as participating in the exposure control plan for the agency are that you are to attend the educational in-service related to airborne and bloodborne pathogens upon hire and annually thereafter. So by listening to this super exciting presentation, you are meeting that requirement. You are to successfully master a cognitive and skill evaluation of the materials. You are to notify the agency of any special needs related to personal protective equipment and or engineering controls. The need for extra, like some examples would be if you needed extra large gloves or if you needed a different size yellow gown. So I need you to make sure and let me know. We have standard things back there, but if there's something special that you need to let me know and we'll get it. You are to appropriately implement the PPE and engineering controls and work practice controls that we've talked about to decrease your risk of exposure. So it's up to you to do these things. You're to notify the agency of any defects in our PPE or engineering controls. Like if you're drawing labs out there, ladies, and for some reason the self-sheathing needle doesn't work, just let me know. You're to notify the appropriate supervisor of any exposure occurrence or symptom manifestations of TB. So if you have any suspected exposure to TB, I'm to be notified immediately, either me or Cherie, and we'll take the appropriate steps from there to get you tested and that kind of thing. I need you to document completely that you have done all the required things that are in this plan in your notes, sign in for in-services, those types of things, and if asked, to participate in selecting safer devices as the needs are identified. Also, to all my staff that do handle needles and sharps, if there's something that we have that's not working, it's not great, just call it to our attention. We'll look at it. We do review those things every year, but you guys are the ones using them, so you know the best. So you know best if they work well or not. So if there's something that you feel like just, isn't safe or could be a little different, we could look at ordering something different. Okay, if you are exposed, okay, to any either bloodborne or airborne pathogens, you need to report it to me immediately. Do not stop, do not pass go, do not collect $250. Pick up the phone and call me or come to the office and let me know. You will have to complete an occurrence or incident report. Right now, we're talking specifically about bloodborne exposures. You would complete an incident report, and we would also have to document our OSHA 300 log. We would give you medical follow up at no cost to the employee, as far as testing that would be needed or any treatment. We would collect lab work from the employee at various intervals for Hep B, Hep C, and HIV. So the intervals would be as soon as possible, or at least within 48 hours of the exposure. That's why it's really important that you tell me as soon as it happens, 6 weeks after, and then 3 months after the exposure. Then 6 months after and 12 months after exposure if it becomes infected with HCV from a source who is co-infected with HIV and HCV. HCV is hepatitis C. We will offer counseling to the employee. We will obtain a physician's order and patient-client consent to obtain blood samples for Hep B, Hep C, and HIV from the patient that the needle stick or bloodborne exposure originated from. And then after that, the supervisor, with input from appropriate resources, will review the incident and determine what, if any, changes need to be made to engineering controls, work practice controls, PPE, housekeeping, or handling of medical waste to prevent future exposure to patient, client, or staff. So it's really important that you notify immediately so we can take the proper steps. If there is airborne exposure, again, you report it immediately to me. You would fill out an incident log as well as the OSHA 300 log. We would initiate any medical follow-up at no cost to the employee, and then we would also review to make sure anything in the future did not need to be changed. Okay, so we talked about universal precautions and standard precautions, and so what exactly are those? We say all the time, well, standard precautions are just the assumption that all patients have something transmittable like Hep B, Hep C, or HIV, and that you utilize the precautions to protect yourself at all times. There's always a risk for exposure, so that means you would wear gloves, you would wear a mask with a face shield if there's a potential for a splash when you're doing wound care. You're going to utilize those things that you learned way back in school about how to protect yourself, using good hand hygiene, wearing gloves, wearing gowns, wearing masks when needed. You're going to use the proper self-sheathing needles and needleless systems when indicated. You also dispose of sharps properly. Whenever you're handling specimens, you're doing that wearing gloves. You're not doing that around where there's food and other things like that where families and patients eat, those types of things. You're cleaning surfaces with our Sani wipes or using a 1 to 10 bleach water solution. You're keeping the appropriate PPE available to you in your car at all times. So make sure that you're keeping PPE in your car. You guys should all have a splash spill kit in your car, as well as a kit with at least a gown, shoe covers, and a mask, and you should have gloves in your bag at all time. Make sure that you do the proper post-exposure follow-up if there is an exposure as far as with reporting, and so we can do those testing things and follow-up if needed, and make sure that everything that could possibly be a hazard, like lab transmission, things are labeled with a biohazard sticker and handled appropriately. Okay, so we're going to touch just a little bit on airborne pathogens. Airborne pathogens differ from bloodborne pathogens in that they are spread by inhaling a microorganism. When an infected person coughs or sneezes, tiny droplets spread into the air and can remain airborne for several hours. There's 3 types of airborne pathogens: viral, bacterial, and fungal. Meningitis, influenza, pneumonia, TB, SARS are all examples of airborne pathogens. If an airborne pathogen is inhaled, individuals exposed on a regular basis are more likely to become infected than those that experience a single isolated exposure. So if you're living in your house with your 5-year-old that has the flu, your chances of getting the flu are much higher than if you just walk by somebody in Walmart that has the flu. Now, can you still get it? Yes, but the odds are more in your house with your 5-year-old than in Walmart. Healthcare providers caring for patients with symptoms of a respiratory illness face a greater risk than just the general public of contracting the disease, generally because we are in close contact with these patients. Think you're up in their personal space, checking their blood pressure, doing your assessments, working with them with therapy, those types of things. OSHA requires that all healthcare personnel be issued PPE, and if you're caring for active TB patients, you be issued a fit-tested N95 mask. The likelihood of the transmission of the TB virus depends upon the duration of the exposure, the virulence of the strain, and the environment in which the exposure occurs. Infection control depends on early detection, isolation of the individual, and treatment of the individuals with active TB. So, some TB symptoms would include weight loss, cough, fever, chills, chest pain, night sweats, hemoptysis, which is coughing up blood, and generalized weakness. All of those are signs of TB. If you have any of those, especially those night sweats, cough, and the bloody cough, you need to get to the ER immediately. Healthcare providers are required to be tested for TB using a PPD skin test annually, or we have you guys complete if there's been no exposure based on your form that you fill out yearly, then you don't have to be tested. SARS, and acute respiratory syndrome, is a viral illness that can be caused by the coronavirus. This virus is spread when a person coughs or sneezes in close proximity of others. Symptoms of SARS include a high fever, headaches, body aches, and body aches. 20% of patients develop diarrhea as well. Most patients have a dry cough and do develop pneumonia as a secondary bacterial infection. The avian flu virus, which is H5N1, is transmitted from birds to humans that have close contact with infected poultry. So, where are my chicken farmers at? There are fears that the virus may mutate, resulting in person-to-person transmission. Symptoms of the avian flu include, or the bird flu include, fever, cough, sore throat, muscle aches, eye infections, pneumonia, acute respiratory distress, and other life-threatening complications. At the current time, there is no treatment for the H5N1. The CDC recommends that all healthcare personnel stay up to date on the most recent flu vaccines, however, that are available. The H5N1 flu is being seen in Asia and Europe, but is being spread by migratory birds. The CDC is concerned that this flu could become pandemic. Our best defense against airborne pathogens is good respiratory etiquette. That means we need to teach our patients to cough or sneeze in the crook of their arm or into a tissue and to use good hand washing. The main thing you want to do here, guys, is just to protect yourself. Okay, and we're going to wrap up with just some information on HIV transmission and prevention among healthcare workers. This slide here, I know it's really hard for you to read. I don't expect for you to be reading it, but I am going to upload it as an attachment so you can read and look over it. However, with some few things I do want you to know, occupational transmission of HIV to healthcare workers is extremely rare. The CDC recommends the proper use of safety devices and barriers to prevent exposure to HIV in the healthcare setting. For workers who are exposed, the CDC has developed recommendations to minimize the risk of developing HIV. Just because you're exposed doesn't necessarily mean that you will develop HIV. So, as of 2013, which I know is an old number, there's only 58 confirmed occupational transmission of HIV and 150 possible transmissions have been reported in the United States. Of these, only one confirmed case has been reported since 1999. Underreporting of cases to the CDC, however, is possible because it is voluntary at this time. Healthcare workers who are exposed to a needle stick involving HIV-infected blood at work have a 0.23% risk of becoming infected. In other words, 2.3 of every 1,000 such injuries, if untreated, will result in infection. Risk of exposure due to splashes with body fluids is thought to be near zero, even if the fluids are overtly bloody. Fluid splashes to intact skin or mucous membranes are considered to be extremely low risk of HIV transmission, whether or not blood is involved. Your skin is the number one defense in preventing infection of HIV when it comes to healthcare exposure. So it's whenever the skin is punctured with a needle that the odds go up. Splashes, they say it's near zero. Some prevention strategies to prevent the transmission of HIV to healthcare workers in the workplace. Healthcare workers should assume that blood and other body fluids from all patients are potentially infectious. They should therefore follow these infection control precautions at all times. Routinely use barriers such as gloves or goggles when anticipating contact with blood or body fluids. Immediately wash your hands and other skin surfaces after contact with blood or body fluids. Carefully handle and dispose of sharp instruments during or after use with the proper procedures. So some other things that have decreased the risk are needleless systems and self-sheathing needles. Continued diligence in the following areas is needed to help reduce the risk of occupational HIV transmission to healthcare workers. Administrative efforts, such as training to make sure that their caregivers are using all the proper systems and the proper managing risk properly. Development and promotion of safety devices, so they're always coming out with new systems. Anytime I'm ordering syringes and blood draw needles for you guys, I'm always looking at what's out there to see if we're using the safest thing and monitoring the effects of the PEP. So all cases of suspected occupationally acquired HIV should be reported to state health departments and to the CDC. And the number to do that there is on the back, and so we would obviously help you guys with that. Okay, so that's going to wrap up this presentation. Like I said, these all of the handouts that you saw today, along with the policy and procedure, are going to be uploaded along with a copy of the slideshow as files that you should download and that you should view. So if you have any questions, you need to make sure and come by the office, call, visit with me, that kind of thing. I'm always available to you guys. Of course, I want you to be as safe as possible. I consider you guys family, and I don't want anything to happen to any of you. Also, want you guys being safe with our patients. So I need you to make sure that you come by the office once you view this and sign in that you have viewed the presentation. If you would rather me email you a digital sign in, I can do that. I just need you to just send me an email and access and let me know, and I'll send that to you. So if you have any questions, just let me know. I hope you guys have a good day.